It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
All right, we're back with our next guest, Dr. David Reuter, a pediatric physician from Allegro Pediatrics. We're talking about preeclampsia, and until recently, I didn't know what this was, but this is a pretty scary deal.
It can be really scary. I mean, particularly for that pregnancy, and it can be treated and prevented with different things, right? And you probably found out about it by knowing someone that was pregnant, and probably towards the end of their term of their pregnancy, they were diagnosed with preeclampsia. It is a scary thing.
Yeah, I mean, there was already some concerns about a friend of mine who's they were concerned about the health of the baby, and then the preeclampsia thing came along as well. So let's learn a little bit more about preventing preeclampsia as we talk to Dr. David Reuter on Como.
Dr. Reuter, welcome back. How you doing?
I'm doing fantastic.
Last time you were on, we talked about measles, and we talked about prevention and wellness, and that's what pediatricians do. You're a pediatrician. But today, I want to talk about preeclampsia. We talked a little bit last time. You have some ideas on preeclampsia, particularly with pregnancy and prevention and wellness, as we said. But what is preeclampsia?
Yeah, fantastic. I appreciate the question. Preeclampsia is high blood pressure that occurs in the context of pregnancy. There's about 25% of pregnant women that get high blood pressure. Preeclampsia is when, in addition to the high blood pressure, you have other symptoms. Some symptoms affect the brain with blurred vision or headaches or rarely seizures. It can affect the liver with inflammation, the kidneys with inflammation and poor function. As it gets worse and worse, the effects on the pregnant woman can be more severe, and you get an increased chance of the baby being delivered prematurely. Our goal is to prevent that.
So let's talk about preeclampsia's cause. What is the root of preeclampsia? Who gets it and why?
Yeah, it's a great question, and I think as a scientific community, we're still trying to understand all the details of what causes it. Two things. Go back. Science was interesting. They figured out how to prevent it before they know all the details on what causes it.
Okay.
So let me give you both. The science, a clinical trial has already shown that if a pregnant woman does something as simple as sleep on her side, sleeping sideways prevents the vast majority of preeclampsia. Now, when I put on my engineering hat, and if you say, well, why is that the case? It appears that something as simple as the mass of the baby, pregnant mom, when she rests on her back, blood can get in and it can't get out of the kidney. And if you affect blood flow through the kidney, that organ that controls blood pressure, then the hormones aren't working as well and you get high blood pressure. So we can maintain healthy blood flow through the kidney if a mom simply sleeps sideways.
Sleeping sideways, but do they know, are women susceptible to it if their mothers had it, or is it a family history? Is it caused by a level of hormones changing with the pregnancy? Is what's causing it besides sleeping on your back and the pressure? Is there any genetic component, I guess I'm asking?
Yep. I think there's two things. Because it has to do with blood flow through the kidney and the veins of the kidney, if you inherit a vulnerable anatomy, you don't have as many different venous pathways to get back. It is true that if your mother had pregnancy-induced high blood pressure, you're more likely to get it, number one. Number two, because we think it's just a mass effect, women with a greater mass are more at risk. The classic example would be twins.
Okay.
But anything there is, even women and adults too, if you have some central obesity, that's going to increase your chances of it. So it's anything that increases the mass and affects blood flow through the kidney appears to contribute to this problem.
Okay, so some of the symptoms that you might experience you're monitoring blood pressure frequently throughout the pregnancy. You may have blurred vision. Is there any other symptoms that go along with high blood pressure, blurred vision?
You can get swelling. Yeah, you can. I think one of the other most common ones is to get swelling in the legs, swelling in the abdomen. You might get some fluid in the lungs, so you're going to be a little bit short of breath. The headaches are going to contribute to it. Hopefully a lot of women gratefully are seeing their physician at regular intervals. And so if you identify some symptoms, even in their most subtle early phase, that's the best time for any of us doctors to intervene and try to prevent the symptoms from getting worse.
I would imagine that this is probably something that shows up during the second or third trimester as the baby gains weight, probably not noted during the first trimester, but more second, third.
It classically is thought of as something that really doesn't start until at least 20 weeks gestation, halfway through pregnancy. And you're absolutely right. The further you go on in pregnancy, the more likely this is to develop.
More with Dr. David Reuter and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We're talking with Dr. David Reuter along with Shannon O'Kelly. The topic, preventing preeclampsia. Here's more of their conversation.
Dr. Reuter, thank you again for coming back. We're talking about preeclampsia in pregnancy. We've set it up a little bit. We know that it's increased blood pressure with some symptoms, headache, maybe some kidney problems, liver, some fluid in the lungs. We also know that sleeping on your side is important versus sleeping on your back. Tell us from an engineering perspective, because our listeners need to know you have an engineering degree from Purdue, and that's a highly touted and rated and ranked engineering school. Why sleeping on your side and what's going on there? And we talked about pressure, but tell us from an engineering perspective, what are you thinking?
Let's look at the left kidney in particular.
Okay.
When blood goes back to the heart, it goes up on the right-hand side. And so when blood goes into the left kidney, it goes in, and when the left renal vein tries to climb up and over the midline, then as the baby gets bigger and bigger, you put pressure on the vein and blood can get into the kidney and it can't get out, number one. From an engineering or physiology standpoint, you then get increased pressure in the kidney. That's a phenomenon called the Page kidney. If there's too much pressure in the kidney, then arterial blood can't get in. And then again, the hormones like renin and angiotensin, the hormones that measure the blood flow through the kidney, they think the kidney's not getting as much blood. They think the body is low on blood volume, so they're going to do some things like hold on to fluid and squeeze down on the blood vessels to increase the blood pressure. So the physiology gets really complicated, but this is as simple as the hormones measuring blood flow through the kidney. You've got this renal venous outflow obstruction, and that's the fundamental cause. And as you said, sleeping sideways is the goal. And so what I'm trying to do is to create some sort of grassroots global health communication campaign that says we all know somebody in the next 10 years that is going to be pregnant or is pregnant right now. And if we simply take it upon ourselves, similar to the SIDS Back to Sleep.
Right.
Back to Sleep did wonders to reduce mortality of infants. Again, as pediatricians, we have two goals: influence behavior to prevent problems.
Right.
And so I'm simply trying to solicit the help of the community to say, let's talk to our friends and family and colleagues if we need. And just a gentle reminder, sleeping sideways does wonders to prevent medical problems, and in this circumstance, high blood pressure of pregnancy.
Is there a preference? I mean, with that left kidney problem you just described, is it better to sleep on your right side or left side? Is there a preference there?
Yeah, I think either one is going to be fine. I think the worst thing to do is to sleep on your back. Sleeping on your left or right is going to be good. It's interesting, I was talking to an OB doctor. She used to practice in Germany, and she said that in Germany, they specifically asked pregnant women to go for a swim. Tummy down is the best thing that one could do.
Okay, yep, take that pressure off those return vessels.
Blood flow through the kidney is optimal if you're tummy down. It's good enough if you're on your side. I think a position that sometimes women might be in would be reclined in a recliner.
Oh, right, yeah.
Right?
Not so good, huh?
The science has also shown that if you sleep on your side, you reduce stillbirth, you reduce high blood pressure, and varicose veins of the legs or the abdomen can be reduced by something as simple as lifestyle modification and sleep position.
There you go. Everything you need to know about preeclampsia. Thank you so much. Hey, remember out there, if you're pregnant, sleep on your side.
Absolutely. Thank you so much.
All right, you've been listening to Dr. David Reuter. You can learn more from AllegroPediatrics.com. The topics have been preeclampsia. And Shannon, it's a great part of this program to be able to learn more about some of these things that aren't that well known.
Well, that's what's great about doing this show, and Health Talk is teaching, instructing, and learning all together, right?
Absolutely. We're going to be back with our final segment right after this timeout. Don't go away. We're back after this on Como.